always and often said that a healthy outside begins from the inside. How do you take care of your outsides? And how do you indeed take care of your insides? That is why we are here today. This is Ask Dr. Ken. My name is Cameron Gukas, and of course, today we'll be doing it a bit differently. We have two interesting guests who will be talking to us about what we have always talked about on this program, assisted reproduction. The very first guest is staring at me strangely. I won't say anything, but it would interest you to know that this guest is the very first indigene on the plateau to be a clinical embryologist with specialty in gene editing and molecular biology. He is someone who has mentored a lot, and we believe that he would be able to share a lot of insight on our topic. Our guest is Paul Schwarji. Paul,
hey,
how are you today?
I'm okay. Very fine.
You were blushing when I was busy introducing you.
Yeah, that's cool.
Okay. The man of the hour himself is beside him, so to say, Dr. Kenneth Eguda. And of course, I'm sure many are familiar with the fact that he is a consultant gynecology specialized in assisted reproduction technology and a minimal access surgeon. He's also one of the leading practitioners in sub-Saharan Africa, which is quite commendable. Dr. Ken.
Thank you.
It's really a pleasure to have you again.
Thank you so much.
Okay. Now today we will be going on to the topic of this course. We're going to look at a particular aspect in assisted reproduction. There's a whole series, a whole process, as Dr. Ken has made us understand in our previous episodes. But today we'll be focusing on embryo transfer. And at first when I heard the word embryo transfer, I was thinking maybe you would remove some fetus and then insert it into a tube and then get a lady, insert it in her. And it gave me a migraine just imagining the entire process. So, Dr. Ken, tell us what it means.
Yeah, thank you so much. And once again, it's a pleasure always having to educate the public and the layman on some basic details about assisted reproduction technology. Yeah, just as you wonder what embryo transfer is, the word embryo actually is a combination of the sperm of a man and the egg of a woman that happens outside somewhere in a prepared environment in the laboratory where assisted reproduction technology is done. So the word transfer just means to move it from where it is produced or where it's cultured and into the uterus, the womb of the woman. So embryo transfer simply means transferring the product of fertilization, which is life beginning, into the womb of a woman. And that happens in the hospital.
Interesting stuff. Now let's go back to you, Paul. Dr. Ken just mentioned that there's a lot of movement. I heard movement. I'm not an expert, but I heard the word movement of embryos. Now, do you need a truck to move these embryos? What is required to move them? Mm-hmm.
Yeah, interesting. You think? I think a lot of people usually come with some kind of wild imaginations and thoughts running through their heads, like expecting to see something that looks like a baby being transferred to them. So that tension, that fear in them makes them begin to carry out lots of imaginations that oftentimes affect them. So when we talk about embryo transfer, the embryos are cultured. That is, after fertilization, they become an embryo. They are cultured for a period of 5 days, and then after then, the maximum of 5 days, so to say. So after then, they are transferred to the woman using a catheter. So it's something tiny that you might not see with your physical eye. Yeah, so it is aspirated or taken into the catheter and then transferred into the woman's uterus.
Okay.
So basically, that is it.
Yeah, so if you had something to that, the embryo, as you rightly said, would not necessarily be seen by the human eyes. They're usually viewed under some special kind of microscope. And then you have this catheter, as you mentioned. Can you just imagine the thickness of the catheter, or the width of the catheter is just about 3 millimeters. That's very tiny, about 2 to 3 millimeters. And then it can go into the womb of the woman to deposit these embryos without any contact or significant contact with the cervix, which is a doorway through which the embryo is slipped into the uterine cavity. So it's a very sensitive procedure, and the items that are moving, as you rightly said, in this case now the catheter carrying the embryos, or the number of embryos, maybe 1 or 2, carried in the catheter, and then it's deposited into the womb of the woman. So it's a very seamless and painless procedure.
Hold that thought. You mentioned catheter.
Oh, yeah.
Is that the usual catheter we know, the one that is inserted for urine?
Okay. Yeah, quite enough. You have a lot of catheters. You have the cardiac catheter for those who are into cardiology and cardiothoracic surgeries and all of that. You have catheter that the urologists use in diverting urine or emptying the bladder. But this is embryo transfer catheter. Okay. So if we want to be specific about the catheters, embryo transfer catheters. And I think of all catheters, it should be the tiniest,
the smallest.
or the smallest of all of them. Can you just imagine the size of a toothpick? Okay. That's just how wide or how thick the embryo transfer catheter could be, and it's just about 30 centimeters in length.
Okay, still on the subject. I'm glad you mentioned the fact that the catheter is indeed smallish.
Yeah.
What should one do before this entire process? Are you allowed to eat? Is a lady allowed to possibly move around? Are there certain restrictions to things she's not supposed to do before the entire process?
You just raised a very important question, and I've answered this question 101 times, and I don't think I'm going to stop answering them, because practically every woman going in for an embryo transfer procedure asked all these questions. Okay. Yeah, the bottom line is that they are expected to live their normal lives. But then we have some restrictions. Before this time, a woman should have stopped smoking. If she does. She should have stopped drinking alcohol. If she does. Coffee consumptions would have also stopped. Even green tea, because all of these have been shown to have some detrimental effect on the embryo and not on the embryo transfer process. I have to be very specific. So they stop all of these. And then they are also expected not to wear perfumes. Wow. Because we're living in a society today that everybody wants to smell nice. The air around you needs to be perceived refreshing. I think I like choice of that word, refreshing. Yeah. But then you see the perfume itself scientifically has some compounds that are very inimical to the survival of embryos. We call it volatile organic compounds. Yes, volatile organic compounds. They contain in most perfumes. And the presence of the volatile organic compound brought into the lab by this woman or whoever it is wearing the perfume can perfuse the entire environment and can damage the embryos. It will not just damage the embryos of the woman, but other people's embryos. So we specifically spell it out. Do not wear perfume on the day of embryo transfer.
Okay. Let's come back to you, Paul.
Yeah.
Do you still have more?
Okay, he has more.
Yeah, like you rightly mentioned, those organic compounds are usually hydrocarbons. So they have a way of interacting with the genetic components of the embryo. So, and genetic components, there are genetic instructions that are being given before the growth and development of the embryo. So once there is an interaction between the hydrocarbons and those genetic components, it hinders the growth and development of the embryo, or it hampers the growth. So
do you know, we've done embryo transfer for a particular woman, and then we have these lists of instructions. We give them the do's and the don'ts, and then one of the, of course, don'ts is not to wear perfume. Yeah. And then this woman actually got pregnant after the embryo transfer process, and good enough. And you go like 3 to 4 months later, I got a call, and I was wondering, of course, usually when you have a call, sometimes from clients who have undergone IVF treatment, a cycle, you are expecting a problem somehow. I was expecting to hear that there's some challenge. How do we come in to help? Yeah. I just heard, please, Dr. Ken, you asked us not to use perfume. Can I start using perfume now?
So she missed it.
Before 4 good months.
Wow.
She hadn't been using perfumes, So the restriction is just on the day of embryo transfer.
But Dr. Ken, let's be realistic. Do you tell people who use perfume around you to lay off perfume just because you're going through this process? Or do you need to quarantine the women so they don't come in contact with people who use perfumes?
Okay, this is quite technical. Usually they read the instructions ahead of time. So, and on the day of embryo transfer, you have the cohort of women coming to occupy their various rooms. Yeah. So they all know that they're not supposed to use perfume. But peradventure, we have somebody who has worn perfume. We have separate rooms in the hospital where we take, and let me use a new word, call it confabulation, we deperfumed them. Yeah. You understand? We clear them of the perfume, before allowing them to mix with the general public. I mean, the cohorts that's going to be having an embryo transfer. So that's what we do to them when they wear perfume accidentally. And some women would always wear perfume. Wow,
interesting but complicated.
And and as a clinician, an IVF specialist, actually, I had to stop wearing perfume. This is my 17th year doing assisted reproduction technology. So I think from my first year, I was quite young then. Oh, wow. I stopped wearing perfume because that's my work most of the time.
I think I'll ask you more about that later because it sounds like it's going to be a painful process to not wear perfume for long. But Paul, let's come back to you.
Okay.
How long after the transfer would implantation take place? I'm asking this because it's all about results for women. People would expect that once they go through this very complex and long procedure, there'll be light at the end of the tunnel. So how long would one expect implantation to take place?
Okay, that's a very good question. I think from the growth of the embryo, at day 5, they are expected to be at a blastocyst stage. And then after the blastocyst stage...
Could you use simpler terms? What is blastocyst?
Okay,
there's no simple term for blastocyst.
Okay, I think it's the highest level an embryo can get to before hatching.
Okay.
Yeah, so we transfer them while they hatch inside the womb or the uterus, so to say. So after transfer, implantation starts immediately from there. But usually it takes about 2 to 3 days.
Oh, sure.
Yeah. Before you confirm implantation, and it can only be confirmed after by pregnancy test. So after 14 days, maximum of 14 days.
Okay. Still, before we deviate, what happens after the 14 days if there's no confirmation? Do you repeat the entire process again?
Well, you do a pregnancy test. Okay. And then there's this HCG that is released into the woman's urine and her blood as at that time. So this is a confirmation that there is an implantation. So after the pregnancy test, if the pregnancy is positive, then congratulations to her. And if it's negative, then I think she might have to repeat the process entirely or start over entirely again.
Okay. Do you have a bit to add to that?
I don't have anything to add to that, but I have something to chip in. You have to cover up for a gap in our previous discussion. You asked what the don'ts, the do's and the don'ts. Usually on the day of embryo transfer, we still ask these women to come to the hospital with some urine in the bladder. I don't want to use the word with full bladder because it's going to be very uncomfortable having the bladder of a woman full of urine. Yeah. So we advise them to ingest, to drink some water, so they just be minimally pressed because the embryo transfer, it's easy to be carried out when the bladder has some urine in it. Yeah. So we don't expect them to empty the bladder before embryo transfer. But at the same time, we know we don't advocate that the bladder is extremely full because we always have this problem, women understanding exactly what is expected of them. And then because you have to ask them, do you think you feel a little bit pressed? They will say no, oftentimes. And they only come to the theater where they are extremely pressed, with bladder full. You can even feel the bladder when you touch the abdomen. And then when this bladder is too full, it also makes transfer of embryos a little difficult because you use effort to keep the bladder full, as not to urinate, and then all the muscles of the pelvic cavity are contracted, they are toned, and then they clamp on the cervix, and so make embryo transfer a little bit difficult. So the whole idea is have some urine in the bladder, and
but not too much.
Not too much. Have it in a state that you can be still relaxed. Yes, and after the embryo transfer, the bladder can be emptied by the doctor, or she could empty it gently after embryo transfer.
Okay.
So that's one very important instructions that's spelled out during embryo transfer.
Okay, let's talk about expectations. I'm glad you mentioned instructions. Now, how should one expect to feel after undergoing the entire procedure? I'm asking this because sometimes it goes beyond having a successful process, right? So what are those things that a lady, how is she supposed to feel after? What are the side effects to expect from the procedure?
This is very tough. Where did you get this from? You know what? This is actually very practical question you've asked, because you have women just have embryo transfers today, and of course everybody expects or they anticipate pregnancy, and they go 7 days into embryo transfer and you get this call, "Hi doctor, how are you doing?" and all of that, and she said, "But I thought I should be feeling something today."
Yeah, exactly.
And I'm not feeling anything.
Yeah.
So there is no specific feeling that they should have. Individuals' bodies respond different to different procedures, and respond differently to the medications.
So there's no certain
certain sign that shows that something positive is happening. But then there are some basic things that they may feel, which is dependent on the medications they are taking. Usually we give them this drug we call luteal support medication that consists of estrogen, or progesterone for some people, progesterone and estrogen, and these drugs have they are drugs that simulate pregnancy feeling. They make you have heavy breaths or full breaths, make you feel lazy, sometimes sleepy, and which are signs of pregnancy. So those are the feelings. But those feelings don't necessarily mean you are also pregnant, because it may just be feeling from the medication. So you don't know where. So the only thing we are interested about is, we hope you don't bleed before embryo transfer, and we hope pregnancy becomes positive. There is no hard and fast rule, or there is no symptomatology or symptoms complex that shows that this is what this woman will feel and this is what she shouldn't feel. You could feel pregnant and be negative at the end of the day. You may feel non-pregnant and be positive at the end of the day. So just to keep it open. And then you have some women, after embryo transfer, they refuse to walk. I was watching, I just came out of theater a certain time, and saw a woman that just had embryo transfer walking to her room, and she was walking, I can't demonstrate that right now. She was walking with leg crisscrossed. You're meant to be walking this way, you walk this way, but she was walking this way. Like crossing, I was wondering what's happening here. Is this a motor neuron disease or something? And I only realized she had embryo transfer. So women feel that when they have embryo transfer, let me use the word, maybe women in Africa, because I didn't see that all the period I was practicing in London.
I think it's everywhere.
So she was crossing, legs were crossing. I was like, okay, something is happening here. She just had embryo transfer. And what was the fear? She was worried that as she was walking, because the embryos is in the vagina or in the uterus, it would drop. Then there's another woman again. She just stepped down from the couch, theater couch after embryo transfer. And we spoke in our colloquial pidgin English. Say, "Madam, walk now." You say, make her walk.
She was expecting.
Say, the thing could drop now.
Yeah. She was expecting to be carried on the wheelchair.
Yes, still in line with that. I remember reading somewhere that some women seem to witness certain side effects like cramping, nausea, and even spotting. Is that natural?
Oh yeah, those are also symptoms that don't necessarily mean anything. Yes, we don't like to hear the word cramping. In fact, if a woman mentions cramping to me, I feel like running away. Because when he wants to bleed, they have these cramps. But embryo is a foreign object, introduced into the uterine cavity. So the body takes time to respond to it. And some of the responses you have maybe those crampings, and they may happen as early as 2 days, 3 days after the embryo transfer. So it doesn't necessarily mean anything. But then you're always afraid when you hear the word cramping. Then spotting, for instance, could happen if there is a implantation. Implantation bleed comes in like a spot, but it is not frank bleeding. When we have bleeding, all of us are quaking because something nasty may just be about to happen. So cramping happens. And it may not be sinister enough to cause failure. Spotting happen. Some of the spotting may cause you to be happy, and some of the spotting may leave you sad and dejected. So it's neither here nor there. But we don't like cramping. I also don't like spotting.
No, not at all.
Paul doesn't like it either. Let's come back to you, Paul.
All right,
Okay, I saw somewhere, still part of research, it said that for women over 60, or for women over patients over 35, right, that there is 60% of success. That's when they go through this procedure. Now, could you take us through statistics when it comes to success rate? What should women expect? What are their chances? Women below 20, women above 20, women above 30. What are their success rates?
Okay, yeah. So when you talk about women below 20, at that age, we all know they are at their reproductive age, and chances of implantation is very high, and you can't compare them to women at 60, because as at that moment they have approved, they are in their menopause or out of the reproductive line as at that moment. So chances of implantation, when you say chances of implantation at 60 is high, I don't tend to agree with that. Well, that is why at some point we give them medication just to help support the endometrium or the uterus, so that once there is embryo transfer, it helps in the implantation. Because as at that time, you can imagine, let's say the wall of the endometrium or the uterus might be dried off because there is no constant release of the estrogen and the progesterone and every other thing there. So that is why we give them such kind of medication, so to enable implantation. But women at that level, I don't think I tend to agree with what you say, that implantation is high. But in our facility, I think we do our possible best, and we've recorded a huge success rate.
So what percentage or what particular age stands to gain the highest success rate? What age range?
Well, let's say people from 30 and below, tend to have a higher success rate, because as at that moment, like I earlier mentioned, this is the reproductive age, and then as at that moment they are sexually active, and then all the hormones in their body are kicking, so to say.
Yeah, that's a very good explanation. Reproductive potential decreases as a woman ages. You understand? As a woman ages. So from 35 years, for instance, you have a very sharp decline in the quality of eggs and the number of eggs, and increase in what we call apoptosis index. That's the damage to the eggs of the woman. And so pregnancy rates usually lower. Then at 40, for instance, you have about 10 to 15% of people getting pregnant with their eggs. And at 46, it's about 1% of people getting pregnant with the eggs, with their own eggs. And so that's because of aging. We will have to take a whole new episode talking about aging and the quality of eggs of women. So at those stage, women coming to access reproductive services or assisted reproduction services will be offered the options of accessing egg donation. And for those who wouldn't want egg donation because of religion, culture, I think we can offer them ovarian rejuvenation. Using the platelet-rich plasma. And I think I should announce at this point, even though we've not made it official yet, that we think that the first baby delivered from a failed ovary following premature ovarian failure, who refused egg donation and forced us to carry out ovarian rejuvenation using the platelets-rich plasma PRP, which is a precursor of stem cells, and a growth hormone. Delivered her baby just 3 days ago. That's the first baby the first in Nigeria, I think.
I feel like I should clap.
Yes, because I don't think there's a center doing that in Nigeria. In Africa, I'm not very, very sure, but I know that quite a number of people are aware of ovarian rejuvenation using the platelet-rich plasma. And so we have others who have gotten pregnant following endometrial rejuvenation, and we had the first one too, not too long. And while we're rounding up this, I think
testicular rejuvenation.
Part of the things that they should do following embryo transfer is that they can live their normal life. They should just take life easy. So women just go rent an apartment, stay in the apartment for 2 weeks before pregnancy test, and they will not come out at all. In the name of embryo transfer. They get bored. They have body pains because of inactivities, or back pain because they have laid down for a very long time. Some of them just lie face up.
So there's no time frame required to rest.
Sleeping position.
Yes, some people, the front sleeping position.
Yeah, exactly.
They lie facing up, and they call that you're having back pain. I say, what are you doing? Whenever I hear back pain after embryo transfer, I just feel, have you been lying down? They say, yes. Who asked you? They say they instruct themselves. Women have ways of instructing themselves to do things that are very wrong, that are unscientific. So just live normal life. Don't just walk beyond your energy level and take life very easy.
Exactly.
We are a bit pressed for time, but before we leave, I'd like to still get your take on the expected foods, the expected exercises, and the expected things one should still do when one undergoes the process. I'm asking this because it's like when you have a headache or when you're sick and you go to the doctors, usually they tell you this is your time frame of recovery. At the end of 2 weeks, please get up and leave your bed. So at what time do we tell women, get off your bags and go and work, go and do other things?
Well, I think I had this encounter with a lady who avoided pepper entirely through the process. Yes, because she had this feeling like pepper is going into her tummy, and then it has a way of affecting the baby or something like that.
Seems extreme.
But there's no any particular food you can go about.
Some of them don't take warm water.
Yes, exactly.
They feel the warm water goes to the uterus and burns the embryo.
Yes.
Africa, where we get this kind of thoughts from. It's very funny to understand that to a large extent, none of those things that you eat in the name of food get into the uterus. Yes, but then we're aware that there are some food that may have some very inimical effect on the embryos. Like recently, the thought of pineapple, apple, those things that have acid, that are acidic, have been associated with some form of uterine contractions. So they ask them to stop. But if I ask you to stop anything after embryo transfer, I would rather ask you to stop sex. Because sex I think should be avoided after embryo transfer, because the pelvic muscles contract during sex, the uterus contract during orgasm, and these are contraction on top of an embryo carrying a primitive embryo, and uterus carrying a primitive embryos. They could actually cause some form of bleeding for somebody who have been on estrogen or progesterone, and the endometrium are a little bit weak and fragile and can crumble easily. So sex, nipple stimulation, I think those should stop until pregnancy is confirmed and it's established. Then you can go on. But for food, I think people should be a bit careful. And as much as I don't know so much about food, it's not my line of training. I'm getting to learn some about food. There are some few food that can be avoided, maybe like the pineapple, acidic food that they say and all that. Okay.
You seem like you want to add something. Should one eat oily food, greasy?
Well, you can go about eat anything you want to eat.
Most women like foundation.
Exactly. I don't think there's any research somewhere that shows that when you eat anything, it has any particular effect.
No,
except for those acidic,
but then you know there are some food substances that can affect fertility itself, like all the artificial food, the processed food have been shown to have some negative effect on reproduction generally. You understand? So, but then not related to embryo transfer.
Okay,
so
this discussion is taking a different turn.
You made it.
Unfortunately, we'd have to leave. We're pressed for time, as I said earlier. And this is Ask Dr. Ken. We've been talking to not only the man of the hour himself, Dr. Kenneth Eguda. We've been talking to Paul Shwarji. And as I said, he is the very first indigene in Plateau State to be a clinical embryologist. I should have asked you how you felt about that, but maybe subsequently we'll talk more about that.
Oh, it's a nice feeling.
It's good to have both of you on set.
Thank you so much.
And I'd say it's been interesting.
Thank you.
This is Ask Dr. Ken. Please take care of your body and your mind will be better for it. Until next time.